marketing coordinator for the Veterans Community Living Center at Fitzsimmons. That's the one that's on the Anschutz campus. And we are so excited to see if maybe we could partner with you moving forward to help serve this community. We have with me today is Stacy Smith, and she's our clinical liaison over here. So we work together in the admissions office, kind of as the front door to assess people, make sure that we can handle all their needs, and then admit them into our home.
And if you'd like, I could do your official bios real quick,
sure.
and then
Absolutely.
we'll get going. And nice to meet both of you face to face. I've spoken to you on the phone for many years, actually. So it's nice to actually see your faces. I love that about this. So Tamara is the admissions and marketing coordinator for the Veterans Community Living Center at Fitzsimmons. She works to help our nation's heroes and their families navigate short and long-term skilled nursing care. Tamara is a human resource professional with over 20 years of experience working with care managers in seniors in the healthcare field. And then we have Stacy. Stacy is the admissions clinical liaison at the Veterans Community Living Center at Fitzsimmons. She has a bachelor's of science in health and human sciences and has worked in long-term care for 27 years. Her history of working in various roles helps provide a wide range of perspectives to those wanting to know more about long-term care. She currently helps assess potential residents and current residents at the hospital prior to return to ensure their building can meet the needs of each person holistically, including mind, body, and soul. So I'll turn it over to y'all so we can get going on this information. Thank you.
Yeah, and if you have any questions in the middle and you want to jump in, I'm easy. Stacy might have to give me a heads up because I've got two monitors going here. But I'm going to just jump in and tell you a little bit about the Veterans Community Living Centers. So we're all skilled nursing communities. There are 5 locations in the state. And what makes us different from, say, a contracted VA nursing home is that we only serve veterans, veteran spouses, and Gold Star parents, not the general public. So, and we only serve those people with significant health care needs. So we're not assisted living, but we handle people that need that daily care. And as I was saying, there are 5 locations. So the oldest one is in Home Lake. That's in Monte Vista, Colorado. And they have 60 beds, 60 skilled beds. That one I really want to get to. I haven't been to yet, but that was built in 1889. So that's the old soldiers and sailors home. So they've had veterans there from every single war in the United States history. They have also, and this is something that might be of interest to your team, they have domiciliary cabins. They are, as far as I know, the only location that the VA is going to be helping to pay for sort of a more assisted or independent living situation. Cabins, there's 48 of them, and the veterans that live there, they can get medical care at an outpatient clinic that's open about 11 hours a day, but it's much more like independent living. And then we have us over here at Fitzsimmons. We're the only location, VCLC location, that is in the metro area. We're by far the largest. We have 180 beds. We do long-term care here. We do short-term rehabilitation here. Hospice, we have a secure memory area. And what am I forgetting, Stacy? Long-term, short-term, we do rehabilitation. Yeah, over here. I feel like I'm forgetting something. But at any rate, we can come back to that. And like I said, we have 180 beds here. And then in Florence, they have 103 beds. Rifle, they have 89 beds and 12 beds of secure memory. And then in Walsenburg, that is our last location. And that's actually run by Huerfano County Spanish Pete's Hospital, but they're between Pueblo and Trinidad. And all of these locations have secure memory care other than that first one I mentioned, Home Lake, with the domiciliaries. And as I mentioned, we serve all veterans. They do not have to be service-connected disabled for our homes to help them. They just need to have an honorable or general discharge. And we serve veteran spouses, and we serve Gold Star parents. So if you have someone that you're working with that's a spouse of a veteran, we can help too, as long as they haven't been divorced or married anybody else. And we just went over what we provide, but we do have the secure memory care at our facility as well. And then I would love Stacy to jump in here. And since you're, a hospice group, we work with hospice.
Okay, so Tamara and I are literally next to each other, so we're trying to figure out the echoing, so I apologize. Can you all hear me okay? Okay,
You're very clear.
so
Cameras was
within
a
our
little bit
facility,
harder.
we do definitely have where an individual can transition over to the hospice or palliative aspect, or we also have the community that comes in. The way that this works within our facility is
So sorry to
because
interrupt.
we're a state-run building, and I know in a lot of the other states, the VA
So
runs
sorry.
the veteran homes. Here in Colorado, they outsource to the state of Colorado. So what does that mean? That
Hey,
means that we have
Stacy.
our own
Stacy.
additional regulatory components in addition to the VA, but we have a sharing agreement. So within that sharing agreement, which doesn't really make sense to me, and I've been here since 2015, and it's just a whole lot of upper jargon stuff that I'm not sure, but it can make it kind of difficult. But what that means is for us is that we have only certain hospices that we are contracted with. They have to go through a bidding process through the Division of Veteran Affairs, which is part of the Division of Human Services within the state of Colorado to get a
Stacy, can you hear
contract
me?
within our facility.
Can
And
you hear
so
me?
how that works is currently we have
No.
four hospices we're contracted with. It's Denver Hospice, Bristol Hospice, Abode, and Compasses. Now, the way that this works is that an individual can come to our facility if they have one of these hospices and they just transition to our in-house team. And we provide the normal standard long-term care, which still means our around-the-clock nurses, our around-the-clock CNAs, the housekeepers, the maintenance, the laundry, the social workers, dietitian activities, all that's the same. But we have a beautiful layer of hospice that comes in. And so they have their nurse, depending on, of course, each individual need, that they're here either 1 to 2 times a week, or if they have to come more than that, if the person's transitioning, that's fine. Or they have a CNA that comes in anywhere from 1 to 2 times a week. Again, it could go up depending on the need. Then they have the social worker and a chaplain that comes in 1 to 2 times a month. And of course, those can always increase as well. But it's just an additional layer of support. Now, for the way that this works is that because we are a state home, we have a sharing agreement, for some reason, financially, we can only take the service-connected veterans that are 70% or higher, private pay, or the Colorado long-term care Medicaid. Even though the VA offers this end-of-life contract or the end-of-life, benefit that could be for someone who's under 70%, for some reason, and this is part of that wonky sharing agreement, we as the state homes are not allowed to use that benefit.
Hello.
I have no idea why.
Hey,
We've
so
had many
Stacy and
division people
Tamara.
trying to work on this for a very long time. And we
Stacy and
just
Tamara.
can't.
And we're trying to get a hold of the speakers
Are you trying to
because
say
it's
something, Laura?
really bad echoing. I don't understand anything.
Yeah, so only one mic and one speaker on if you're in the same room. I've been trying to get your attention.
Oh, I'm sorry.
Only one mic and one set of speakers on if you're in the same room with each other.
On my speaker.
So speaker and mic, only one, unfortunately. So sorry to ask you to repeat, but could you name the hospices that you contract with again, please?
Try yours again. Laura, now I have my speaker on. I turned it off while Stacy was talking so that you could hear her.
Mm-hmm.
So did you need her to start over?
No, just do we need her to start over? I feel like that's a big ask. I don't know. It was tough to hear.
She turned off hers so she could just stay over here on this side if that's
Okay.
here.
Thank you. Sorry, it's so tricky when you're in the same room.
Yeah, no problem. I think we were just covering end of life benefit and how unfortunately we're not
Yeah.
able to take that here. So what if you
Yeah,
hear any of it or none?
I did hear some of it, but could you list the hospices that you contract with again? You
Sure.
named 4.
Absolutely. So the 4 that we're contracted with is Compasses, Abode, Denver Hospice, and Bristol. And I'm sure you were trying to get our attention, but we have the really bad state old computers. So, right. So we can just see my screen, right? Yeah. So we're basically desperately trying to make this work, and I apologize. So what I was trying to say though, with the contracts, if someone is with your end of life benefit of the 70%, if they're under 70% service connected, and it's an end of the life benefit, we do not, for some reason within our sharing agreement, we do not accept that part. They would have to go to a contracted home. So in order for us to be able to take one of your veterans or their spouses, they would need to have, the veteran would need to either have a service-connected disability of 70% or higher, the private pay, or Colorado long-term care Medicaid. Okay. All right, I'm going to just kind of go right over this slide quickly because I'm sure you know as caregivers what would qualify someone to be in our facility as far as a care need, but we are a higher level of care, not assisted living. So basically either their doctor's orders or just needing help with those ADLs or any kind of 24-hour need that they would have that needs medical monitoring for the 24 hours. Stacy sort of covered this, but what we accept is the service-connected veterans. Your veteran service connection at 70% or greater is going to trump everything. So for short-term, for long-term, for hospice, and so on and so forth, if they're 70% or over, we're good. For spouses, our spouses are here. All of them that I know of are here under their Medicaid. The VA does not pay for long-term care or rehab care, any kind of per diem for a spouse. Private pay for a spouse is around $12,000 a month. So most spouses are here under Medicaid. For private pay for a veteran, that's $240 per day. And we also accept the Medicare and, as we mentioned, the Medicaid together for long-term, or the Medicare unmanaged for short-term. I know that's kind of confusing. If anybody has any questions, I can address those at the end about payment.
Could you share your screen again for the PowerPoint?
Yeah, it's not shared anymore?
It's not. Mm-mm.
I
have a big green thing that says you are screen sharing.
Yeah, I still see it.
You still see it, so it's just me? Oh,
I was like, wait, no, okay.
never mind.
Okay. That's okay. Okay, we good?
I don't see it, but if everyone else does, then that's okay.
Okay. So when your patients or your veterans or families are looking around, we do have comprehensive daily care, meaning that no matter what payer form you're using, be it Medicaid, self-pay, or your service connection, we're going to cover everything here. That includes your hospice care, all the medical supplies, incontinence products, any medications. We cover transportation to and from in the area for medical appointments, oxygen, just everything. We have a great activities program. And, you know, Stacy, if you want to chime in, you can, but even on hospice, it's not like they're brought over here and just left in the room. We still have a lot going on and invite a lot of activity. And Stacy can speak a little more to this. I just love the way she explains this about the hospice. So basically, we encourage them just because they're hospice, the only difference is that they just get that extra support level of care. But we as a facility just 100% engage them in our facility life. We treat everyone here like a family. And I know that's kind of cliche and a lot of places say that, but out of all my years of working in long-term care, this is definitely the place that I feel like we do it the most out of. In the places I've been in, and with a sense that we really do try to engage them to get up just because they're on hospice and they may, you know, be a terminal diagnosis. You still get them up for activities. You still get them up for meals. We don't like having people isolated in their rooms. However, if that's something due to medically that they need to have, of course, we honor that. But we would be asking, we just want to involve them as much as we can, and we try to honor them within our facility life. And a lot of the staff, don't know that they're hospice, and that's probably good. It's only the direct care staff that need to know that. That way we honor them fully as just an individual. And a lot of times with the additional support, they get a little bit more kind of those last enjoyable quality of life that they can have. And that's what we want, is quality of life versus quantity of life. That's kind of the mentality. And I hear Stacy tells families that are struggling with this and veterans that are struggling with this all the time because they are a little resistive maybe to going on that hospice care. You're not coming here to die. We want you to come here to live. We want you to be as active as you want to be here and be as a part of as much as you can here. So we have staff that can help you get to that live music or bring things to your room that you're going to find entertaining and worthwhile. So yeah, the VCLC difference. On this slide, I always like to tell people, if you are in the area and you are, just pop over, give me a call. I'd love to take people for tours because we are so different feeling than a typical nursing home. Of course, it's veterans. It's a little service oriented. You can see our little therapy dog Munchkin down there on the slide, but we have the military activities and things like that, but also just different feeling. I would say between 95 and 98% of the people that come here for a tour, they immediately want to be in our facility and want to be considered. So I think that speaks to the care we give and the atmosphere we have. I can tell you that we're having the same caregiver struggles as everybody in the country as far as trying to get enough staff. And we're not a heads in beds facility. We do assess everyone to make sure that we can handle all of their needs with the staff that we have. But most of our turnover in our facility would probably be at the CNA level. I've been here 6 years. Stacy's been here over 8 years, and I still consider myself kind of a newbie in the building. All of our unit managers, all of our nurses that I know of have been here much longer than I have. We have 2 social workers that just celebrated their 21st anniversary, as did our recreation director. So a lot of longevity in the building as well. If you have anyone that you think might be a good fit for us, I am happy to be your first point of contact. Let me move over here. I think I added my contact information. I did right there, and I can send Laura and Becky all my contact information, any flyers you guys want, business cards, but I am happy to chat with you, chat with the family, give anyone tours, and give you all that information and to take a look. We like to take a look at any referral, and if we're not the best place for you, we're always going to direct you to other places. And we don't like to leave anybody hanging, so we're happy to help with any general questions or specific questions about our facility. And that is pretty much all I had for you today. In case anybody has any questions for us, we're around. Oh no, now I can't hear you. Unless I can hear you, Becky, can you still hear me?
I can hear you. Can you unshare your screen? I actually can see your screen now.
Okay, let me see
There we
how
go.
to do that. Share.
Thank you
Actually,
for
Tamara, I do have a question.
Yeah.
Okay, so my question is if they're 70% disabled or higher, they can go there for free. But if they're less than 70%, is it 240 a day if they're a veteran?
Yes, so there's no sliding scale, and I'm sorry I can't figure out how to unshare my screen, but there's no sliding scale. It is $240 a day, plus you have to have unmanaged Medicare, and that's a little in the weeds. We can help get someone unsubscribed from United or Kaiser or what have you fairly easily. But yeah, it would be $240 per day, or having applied for Medicaid. So let's say you're surprisingly needing this care and you're just getting your Medicaid application in. As long as I can look at that Medicaid application, we can look at somebody. Yeah.
Thank you.
Yeah, of course.
I'd like to ask a question. Stephanie Hartz, VA social worker. Thank you, ladies.
Stephanie, hey, Stephanie. Look at Stephanie Hartz. And I'm gonna, you know what? I should have added Stacy's information to this as well. So I will email that with anybody. But hi, Stephanie. We work with Stephanie all the time.
One thing that's really helpful for me to know is, do you have current availability for veterans and rehab, long-term care? What is your current status?
Yes, thank you so much, Stephanie, because I can't believe I forgot to mention that. We do not have, nor have we had in the 6 years I've been here, a wait list. We have plenty of open beds. As I said, we assess everyone to make sure we can handle their needs, and we can get you an answer once you get us an application within 1 day, usually, possibly two. But what we do is kind of a two parts to our application. So I get all your demographic information and military information from the family or from the caseworker. And then I get together all of the clinical information, give that to Stacy and her team, who goes through that, and then we get you an answer and we can turn that around. Sometimes we have people get us information and they move in the next day or within the next 2 days.
The thing to keep in mind is that we do have sometimes, like this week is really kind of slow for us. We've only had like 6 or 7 referrals, but with last week and the week before, we had almost 20 referrals. So there are times that, it may take me a little longer to get through. Part of what I do, and I know that with Laura and Stephanie, you all know this, that I call the families. I ask a lot of questions. I call the veteran themselves or the spouse. Part of that is we really want to make sure that we're meeting them and making sure we can meet their care needs. So we do look at everyone very fairly. And if I know there's kind of an emergent situation, we have, in a sense, we can't do this always, but if there's an emergent situation, we have kind of bumped people, ahead of the referrals that I get, but we try to do them in order that they receive. So that's why it's always good to get as much of the information we can in the beginning. And Tamara and I, like I said, literally are staring at each other all day long. So she can throw it at me and then I can do my part.
And something else that might be relevant to the people that you're serving, we do have semi-private rooms. They're very nice. They're 11 by 11 rooms. And there's one room right next to another room. So when you walk into a unit, you're going to walk into a short hallway with a shared bathroom on one side. And then you see 2 hospital curtains kind of coming out in a V. If you go through one, that's one room. Go through the other, that's the other. But each room has their own large bay window. They have their own furniture, call light, temperature control. So it is a semi-private situation. When someone is actively passing, we don't change that, do we, Stacey? We don't move someone from there. So it'll still be semi-private, but we have comfort carts set up for family. This is also a time where, of course, we let people stay with their loved ones. So when you first admit here, if you're living with us long-term care, there's no visiting hours. You can come see your loved one anytime you would like, but you can't stay overnight or sleep here. And that kind of can be flexible once a person is actively passing.
You mentioned like if we can provide the care for them. So I'm wondering if there's certain behaviors, diagnoses, certain things that would make somebody not a good candidate for your facility. And again, you're speaking to professionals, so you can be honest with us.
Yeah. You know that it's Stacy again. I'm very honest, as a few of you know, this is what we can handle and not handle. So one of the things that we are having the greatest struggle with currently is if someone if someone still has a trach, and I know even though it might be comfort, like some people never had them removed, but it's capped. That's something we probably medically couldn't be able to handle that well right now, or any drains. It's very specific kind of what kind of drains we're able to do. We had a person who was referred out to us and they had dual drains, not just from their kidney, but also their lungs. And I didn't feel like we were able to safely manage that with our staffing levels. So those are kind of case by case. But specifically behavior wise, we are without a mental health provider. Our mental health provider left without notice, unfortunately, and we've been trying to replace that, and we're actively trying to work on finding someone, but not many people want to work in long-term care mental health. So if someone has intensive, and I mean like active psychosis right now, or if they have a diagnosis of schizophrenia, but they need to have active counseling treatment, I cannot manage that right now because I don't have a provider. Hopefully that will change, and we used to be able to do that a lot more. I used to be a floor social worker, and we had many individuals that had many
many behaviors, even from aggression and all that, that we were able to manage, but we just cannot do that right now. If someone is physically combative towards other residents, that is something that we are not able to manage right now. Or if they're physically aggressive towards our staff, I don't have that mental health behavior support in-house like we would like to have. So that's kind of, but don't think that I can't take anybody with a mental illness, because I still have those individuals. It depends on their stability and the level of active acuity within that mental illness. So I'll still look at it. And for you that have talked to me, you know I'm going to be very honest about it. For my secured neighborhood, if someone's really aggressive, then those are ones I probably would say no to as well, because currently I have a lot of military police on the secured neighborhood, and they think they're still in their 20s in military police. And if they hear anybody that's aggressive, then they will literally, quote, take them down in military positions. So I try to limit others that may be aggressive right now, just because we don't want to injure the new people coming in or the current residents. But like Stacy said, we do love to look at every referral. We love to say yes to everyone we can. So sometimes, you know, her team will look at that very closely, and then, you know, pull in who we need to in the building if we need to get a really comprehensive answer. But yeah, we love to help everybody we can. Yeah, but anything that's like active SI, active homicide, you know, things like that, we can look at people who are on the sex offenders list. I can't tell you that I've taken many, because again, those are all on case by case basis. It depends on when these issues happened and what they were. So we still like to look at everyone.
That's really helpful for us to know. Thank you.
And my understanding from earlier when you shared what hospices you're contracted with, that if somebody on a different hospice had a patient appropriate, they would have to change, they wouldn't be able to continue to see that patient.
The reason we've tried this, but it's a contracting, or credentialing issue. Go ahead, Stacy. It's a long issue. Yeah, in order for them to stay on the same hospice, they would have to get a one-time contract with not us as a building, but the state of Colorado Division of Department of Human Services. So it's a long process. We just tried that with another person, and it was already going into over a month, and it really hadn't been progressed as quickly as it had been. So that's the problem. Because we're managed by the state and by two divisions within the state, it has to go through this whole level of black tape that none of us know about. And then also every employee that's within our state home, everybody that comes in has to be credentialed, and that's a 2 to 3 week process. So part of what the hospices that we're contracted with is they know they have to have a very large amount of people that are already credentialed. So no matter the time of the day, they can come in. Yeah, so even though, you know, and Stacy and I have been working on this quite a bit, because we would love to have all of our veterans be able to stay with the hospice of their choice. However, we can't pre-credential people in hospice, because those credentials need to be used within a certain amount of time or they expire. So the timelines just weren't matching up for the folks that needed that immediate care.
So the people you have contracts with have people who are credentialed through another route.
Yes. So as I understand it, is if a Bode hospice has 40 employees, all 40 of those have to go downtown, get their fingerprints, get their credentials, do that 2 to 3 week process, so that when we're calling, when other providers with that one are out or on vacation, anybody can come in.
Okay, so credentialing is a process specific for veteran community living centers.
Yep. Yes, it's a process.
That's helpful to know. I didn't know.
Yeah.
Are there any other questions for Tamara or Stacy?
And Becky, would it be helpful, and if it's not, that is okay, but would it be helpful for me to send some business cards and things for you to share with your clients over there? Some information?
Well, we're all over the place. So if it's electronic,
yeah.
I'm going to share the
I can send you
PowerPoint.
Yeah.
But we're all over the state of Colorado on this call, and
Okay.
I am
If
curious
there's like an
about,
electronic brochure, those are really helpful to give
yeah.
to veterans and their families, even over here at the VA. I'd love to share that.
Yeah, and I'd love to get you all Stacy's information too, because if you have clinical questions, she's going to be typically I would be the first door, but if you know that your veteran is service connected and you're asking clinical questions, you can just call Stacy and ask her. Yeah.
And we work with,
I do have a question. Oh, go ahead.
oh, go ahead. Go ahead, Laura.
Oh, some skilled nursing facilities have started like little dialysis things on site. It's super cool and seems like it's kind of up and coming. I wondered if that's something that y'all have ever done or are working on or anything like that.
We have not. What we do when
Okay.
we get somebody that has dialysis is we make sure that we have dialysis close enough to us and that our transportation or their family if they can handle it. But again, because of the sharing agreement, it's not. Yeah. There's only 2 locations. Yeah. So I believe we contract with DaVita and Fresenius, if I remember right. Don't hold me to that. I know DaVita for sure. Yeah, well, and the VA. Some folks do go back and forth to the VA. Yeah.
Is there anything you ever, like the community can help support what you do? And I'm asking from a We Honor Veterans perspective. One of the things that we're asked to do when we're a We Honor Veterans partner, and there's 5 different levels, but I believe level 4 and level 5, we want to, and we're also required to participate in supporting veterans out in the community, which I think the Veterans Community Living Center would be a wonderful place to provide, whether it's a military recognition ceremony or supporting you in some way. Or is the vetting process so much that would be hard, the credentialing process? But if there's
No,
a way we could
not for
serve you.
volunteers. No, and thank you so much, Becky, for asking that question. And we really do appreciate any kind of mutual support. We would love to support you as well. My first thing I'd love to say is just getting the word out that we're here. We have a reputation, unfortunately, that we're difficult to get into, that we have a long wait list, that and it's not true and hasn't been true for a long time. So just getting the word out, I am happy to share resources. I am happy to speak. I am happy to come out and set up a table anywhere anybody wants me to. Any local veterans fairs. We've been to quite a few this year, retiree events, and I've spoken at museums, veterans museums, but all of that stuff. And we do have a I shouldn't say huge, but a lovely volunteer department here and activities department. So I can refer anybody that would like to volunteer here through Leisha, and it's not the same credentialing. The credentialing is only for caregivers, health caregivers. So the volunteer, it's much simpler process. So, and I know we love to utilize volunteers for anything here. We have a vet-to-vet cafe where current service people come and talk to people here. We have the ROTC comes and they set up for a disco here. We've had all kinds of cool stuff here. Lots and lots of activities. So yeah, we love that.
Thank you.
Thank you.
Any other questions?
Well, thank you so much for having me, and I'm happy to, like I said, give any tours or answer any questions. Stacy and I are always here to help.
I guess my last question is so you're either working with the VA or hospice social workers on, for this group. Is there any type of information outside of the typical referrals that we do? Like anything to make your job easier when we're trying to refer somebody to you?
Sure. Only getting the military data for sure, because we don't have access to your records. So anytime you send a referral, if you can send me a military data sheet and a face sheet, then that's great, because a lot of our folks just don't have theirs anymore. They've lost it or what have you.
And then from the medical side, it's definitely important for us to have any specialty notes, and if there is any mental health notes that we need to be aware of. And then people think it's important for us to know, even if there's a specialty like a podiatry note, if there's something. So just make sure we always have the last specialty note
and immunization records, because that's just some components that we need to be mindful of. And then any social worker behavior kind of stuff that we need to be aware of. And it could be simply that the family has a different point of view than the veteran, and we need to honor what the veteran says or something. Just make sure we know all of the family dynamics too, because then what may happen is that we get a call and I'll call the son and he's telling me, well, no, dad doesn't need to come to the nursing home. So just anything that really makes us be able to look at the person fully. I say that clear a lot holistically. We really look at the person in every aspect, not just their medical needs, but psychosocial needs. Once we get to know someone, Stacy and I are going to be looking at where would the best room for that person be. Do they need to, because of their PTSD, have their lights on or off all night? Do they need to listen to their TV at an extreme volume? Are they, barricading the door? Whatever it is, so that we can make sure they're as comfortable and successful as they can be over here. So when I get a referral from the VA, typically it's going to have that face sheet, the military data sheet, and then all of those records Stacy's talking about. And then we would just call you right away, typically even before we call the family, to thank you guys for the referral, see if there's anything else we have to know, get powers of attorney and all that good stuff. But yeah, and it's usually pretty easy working with you guys. So thank you for that.
I do have a question about because we're up in Evergreen and a lot of our folk live out in the mountains. We actually have referred people to Florence. Do you act as a central admission spot, or do we have to go to each individual?
You would go to each individual. So we're sister homes. We work very well together. So let's say someone applies here. I'm happy to send that application information at Florence. Florence might then, though, have another couple of different forms they use. So we all have a central, say, admission application. We all have a central admission agreement, but the little minutia, it can be a bit different from home to home. So they just yeah, so you probably want to call that home directly, because they might be on hold and we might not, or something like that.
Well, thank you so much. If there's not any other questions, we'd love just resources that we can distribute electronically to everybody.
I've got it right here. Thank you so much. Thank all of you for your time. We would love